Hello, welcome back. We're going to have three brief videos on common sense approaches to risk reduction from COVID 19 and to answer the commonly asked question. The first one, we're going to discuss what's COVID 19. It's a single stranded RNA virus. It belongs to the family of enveloped coronavirus family. Its genome encodes several structural proteins, including that is necessary for production of virions. The outer surface has spikes. COVID-19 uses these spikes, so-called glycoproteins, so-called S protein, to get attached to the human cell ACE2 receptors, angiotensin converting enzyme receptors, and the use of S2 protein to fuse with the virus with the host cell membrane before entering human cells. So how does it transfect humans? The most common way it transfects to humans is as airborne through inhalation. These smaller droplets arises from sneezing, can travel through the air as an aerosol up to 20 meters. Therefore, the social distancing of 2 meters not necessarily will protect the individuals from such exposures as in enclosed environments like rooms and halls. Therefore, the importance of using effective face masks, just like this one, N95, and try to keep the social distancing as much as possible. More importantly, the larger droplets derived from cough and while speaking, however, can spread only up to 1 to 2 meters. That's the magic 2 meter numbers come from, and contaminate smooth surfaces like the glass, wood, as well as stainless steel railing, for example, which can transmit or contaminate the fingers, and if someone touches the mucosal areas like eyes, nose, mouth, for example, it can self-transfect this virion to yourself. So the importance of hand washing when you return home. So the larger droplets, while can contaminate you, about 80% plus of the infections are derived from small droplets which travels through the air because they are much lighter, smaller, and contain larger number of particles. Since the virus survives better in the colder, drier weather condition, it spreads faster during the winter time, especially that conditions like drier weather with the cold can allow to multiply the viruses and increase the viral load, so that infectivity can increase during winter period. Hence the well-known flu and common cold epidemics during the winter periods. Coronavirus, particularly the COVID-19, primarily affects the lungs, and also it can affect the cardiovascular system, especially the microvasculature, causing microemboli into the lungs. So what are the consequences of having COVID-19 infection? Although it's highly infectious, the death rates are significantly lower than other recent coronaviral epidemics, such as MERS and SARS epidemics in early 2000s. Since the immunity obtained following infection may not last long, it could reinfect some of the patients who had the infection earlier. So this is another important aspect for the effectiveness of the so-called COVID-19 vaccine. If the general immunity retained by people following the infection doesn't last that long, there's no reason to us to believe that immunity acquired through injections of vaccine will no longer last either. So in other words, it's going to need a repeat injections with adding to the cost and significant adverse effects. So in any case, more than 95% of the people affected by the coronaviruses in COVID-19 recover on its own without any need to ICU or that kind of admission. They are highly unlikely to need ICU admission, nor developing any terminal acute illnesses like respiratory distress syndrome, etc., or multi-organ failure and death. So this terminal event generally occurs through the cytokine storm, which is generated by the production of massive amount of chemicals called cytokines, the large number of inflammatory chemicals. This can produce massive inflammation throughout the body, leading to cytokine storm and during the acute lung damage leading to death. Interestingly, all these can be reduced significantly if one having a stronger immune system, and that can be influenced through micronutrient adequacy, specifically vitamin D supplements. So the complication and death rates are higher, especially in the elderly and those with multiple chronic diseases such as hypertension, diabetes, obesity, chronic lung, cardiovascular or renal diseases, and indeed in current smokers. The worst outcomes are in those with a severe vitamin D deficiency, by definition having levels less than 10 nanogram per milliliter. The next question people ask is there a tangible progress with the antiviral agents or vaccines? Indeed, there are a lot of propaganda with a little progress one could see. Despite the vast propaganda, it's unlikely that there will be a safe, affordable, and effective antiviral or vaccine against COVID-19 soon. We never had a success anti-corona vaccine fulfilling those three specific areas, being safe, affordable, and being effective. Also, it's possible that the beneficial effects of the vaccine only last for a few months, requiring repeated doses and subjecting to more adverse effects and possibility of death as well. Therefore, fully relying on vaccine will be as bad as depending on the herd immunity, as happened in the United Kingdom, where they got into a real mess. Beneficiaries from COVID vaccine will not be the population, but the investors and the companies who make the vaccines, so as some of the administrators. So the politicians who are backing and eagerly jumping onto the bandwagon to accept vaccines do so without understanding its consequences to the population. Moreover, COVID vaccines are only a part of the solution, not the panacea. So what is community spread and what's the benefits of PCR testing? Despite denials, community spread is occurring virtually in every country. This is due to too rapid relaxation of public health measures like social distancing and not wearing face masks properly. Wearing the mask on the chin is the bad option. And also the crowded public transportation, having larger scale book fairs, for example, where millions of people attending and participating in infectious gathering, all can spread community-wide COVID-19. So as per the previous studies published by multiple countries and communities, especially in US, it has been shown that when in the absence of community testing, each person diagnosed having PCR positive in the hospital or in the quarantine center, there could be on average 20 people in the community with PCR positive, and 95% of them are asymptomatic. Therefore, the larger number of potentially infected people are in the community at any given time undiagnosed. So, for you to get an idea of your own country, you need to multiply by the reported statistics of PCR positivity by 20 times to see the actual number of people infected in the community. Out of that, 90 to 95% of the people are undiagnosed, so unidentified. So, as I said before, the more than 90% of the people who are PCR positive neither have noticeable signs and symptoms or any need to get admitted to the hospital. Majority of them could be asymptomatic carriers, can spread to the disease to others, especially to the elders. Approximately 95% of the affected people will revert to normal within a few days, with or without a therapy. Despite these, few healthcare workers in different disciplines falsely claiming credit for curing this group of people otherwise could have recovered on their own without any intervention whatsoever. Some of them may not even have had COVID-19 due to false positive PCR testing. So, these claims also made by many in the absence of any control treatment group. So, it's really totally irresponsible and unreliable to listen to these kind of misleading, curable claims by many. So, in the next section, I will address a question related to immunity that need to overcome COVID-19 infection. So, let's continue to answer the community question the people are eager to get to know. So, COVID clearly is an airborne disease. Therefore, wearing effective face masks and keeping personal distance between people are the two most important items. The likelihood of getting infected from contaminated finger and food is approximately 10% of all infections. Routine temperature checks, for example, as currently done even in restaurants and shops, are totally unnecessary, the wastage of money, and is a worthless exercise. Apparently, this was mandated the temperature checking was mandated to enforce selling of container loads of imported electronic thermometers by some influential people. However, thermal camera mediated temperature checks are useful in all ports of entry, including airports. It's the type of people coming in and out from these places are very different from people going to restaurants and shops. As with tsunamis, the second wave of COVID-19 is worse than the first. Despite false claim that the second wave was spread worse due to mutation, change of the virulency of the virus, or even some claim that it's a new virus. But there's no scientific evidence of any of these. Instead, it's due to a carelessness of the people and high viral density due to the lack of social distancing and people gathering in larger numbers. This further emphasized the importance of adhering to essential basic public health measures. The next question is, what does PCR test tell us? So what information we can gather? Polymerase chain reaction, which is PCR, is an amplification technique to detect minute quantities of a small part of viral fragment, not the virus. So the presence can be identified, does not indicate that it's a virus actually present in that person. Moreover, it can be false negative or false positive, especially when you use the poor quality PCR testing kits. So just because a PCR test reported positive not necessarily mean that the person is infectious. Similarly, a person found PCR negative today can become positive in few days later. This is either due to false negative test results or more likely that during the early incubation period of the virus and may have not have had a chance to get these viral fragments distributed. So, do the governments take flawed actions such as curfew following misinterpretation of their own data or lack of understanding of statistics? The answer is yes. We have seen more than once this is happening in multiple countries. In the absence of holistic approach, decisions purely made on the PCR numbers lead to wrong interpretation and taking wrong action. For example, it is misleading to use a raw number of PCR positivity, hospital admissions, or deaths without standardizing these data for policy decision making. Data must be interpreted not as raw data, but always as rate or percentage of either infection or deaths, for example. For example, as happened in mid-October, just because PCR positivity numbers went up does not necessarily mean that the rate of infection or deaths is exponentially increasing. The detection of raw numbers went up simply because the number of PCR tests done was increased by about 20-fold in late October. In an environment of ongoing community spread of COVID-19, not as claimed by Minuwangoda or some other one cluster. The COVID-19 has spread across in Sri Lanka, for example, all 25 districts. This is community spread by definition. Making policy decisions based on raw PCR numbers alone will cause chaos. As such, the enforcement curfew in October. To avoid such misinterpretation, it must be based on the infection rate, severity rate, or case fatality rate, and not the absolute numbers. None of this has significantly changed from between April, May, June to October, November. These are still statics when you convert the numbers into real rate of change. So why taking drastic action when there's no exponential spread of the disease? So the next question is, does the immunity protect those who recovered from infection? So this is also related to, in part, to the vaccine efficacy and whether people are going to need vaccine every few months. Because the immunity generated following COVID-19 could be short-lived, we don't know exactly if this is true or not. Reinfection is possible, and some people it has happened, but at a lower rate. If this is the case, then herd immunity will not work either. So the model the United Kingdom has been using, no wonder it's a total failure and increasing the number of affected people as well as the deaths over the last 3-4 months. More importantly, the effect of vaccine is likely to diminish within months or perhaps a year. Therefore, repeat vaccination will become necessary, which markedly increase the cost, serious adverse effects, and potential deaths. COVID-19 is going to be with us for a while. Therefore, it is important to properly prepare both physically and mentally for this prolonged viral illness. For preventing COVID-19 infection and staying healthy, maintaining a high immunity state is the most important, nothing else but maintaining good immune status. This can be achieved naturally by getting exposed to sunlight on a daily basis, at least 30 minutes between 11 or 10:30 and 1:30 during the midday time. So in the next section, we are going to discuss about the minimizing risk and counteracting COVID infection. So, first question is, does ventilation, having good ventilation, reduce the enhanced spreading of COVID-19? It is essential to allow fresh air entry into rooms and buildings to flush out potential viral particles. So it's a good practice to open the windows and doors. The virus lives longer in a colder, dry, climatic condition, including the air-conditioned setup. Thus, humidification of air-conditioned areas and rooms, especially during winter, can be effective in reducing the viral load and thereby the spreading the infection. Whereas cooking food by any means, using heating, microwave, etc., will kill COVID-19. So rather than eating any raw food, try to cook food. That way you can eliminate the possibility of any contamination, although it's very rare to get the food contamination to human. For example, the spreading COVID-19 for fish market has nothing whatsoever to do with fish, meat, or any other animal product. It is simply because these markets are highly crowded, and one or two people who are selling or coming to the market is infected, they can spread the disease very, very easily into yet another community spread or focal group of spreading COVID-19. Air conditioners that with HEPA filters are not installed can spread COVID-19 through the entire building. So it should be used, air conditioning should be used sparingly on and off rather than having the continuous 24-hour air conditioning system. And the filters must be changed on the more quicker than the recommended time period. Whereas the chances of getting COVID-19 infection from boxes, plastic bags, mail, packages, grocery items, books, clothing, and footwear, for example, are minuscule and indeed negligible. Therefore, changing clothes and taking shower each time when you return home is totally unnecessary. How can we prevent getting infected from COVID-19? Apart from the three baseline parameters like wearing mask, washing hands, keeping social distance, COVID-19 is a virus, despite claims, can enter into the body through any of those means. However, a person cannot do much at all to get rid of it. So drinking hot water or alcohol, mouthwashes, any kind of food or drink, including recently advertised immune boosters and syrups in TV and radios, and concentrated herbal cocktails are totally ineffective in getting rid of COVID-19, so as steam inhalation. Others advocate falsely rinsing nose and sinuses, steam or sauna, engulfed in superstitious activities or religious engagement expecting a cure, or consuming vinegar, alcohol, kind of juices, ginger, turmeric, and herbal therapy, or even the use of standard Western, Unani, or Ayurvedic medications. These all are totally ineffective in eradicating the virus once the virus is getting inside the body. The only cure comes from naturally within yourself through having a stronger immune system. Engaging some of the above, for example, attempting to raise the body temperature above 56 degrees Celsius, is very harmful. In fact, it's likely to kill the person before the virus itself. So don't even bother to think about it. The way to get rid of COVID-19 is to boost and maintain the immune system at high alert. So when any kind of virus or bacteria enters, immune system will be ready to get rid of it quickly. One should use it as an internal body armor against a virus. This is a natural phenomena and a potential cure. What actions are effective in controlling COVID-19? Adhering to basic public health policies such as wearing masks, distancing, and staying away from people who are sick, sneezing, coughing, or having a temperature, and temporarily isolating them, and keeping the social distance are good areas to follow. Consider spending minimal time in confined spaces, including supermarkets, classes, banks, religious centers, shared vehicles, transportation, and participating in any kind of ceremonies. Also, regularly engage in physical activity, mental relaxation, and breathing fresh air help to maintain a good immune system. The use of regular cloth masks may protect others to some extent, but will not effectively filter the incoming COVID-19 viruses to protect the user itself. Regularly cleaning of face masks in soap and water is also important to keep the pores open so that you get enough air without obstruction. Wearing gloves, on the other hand, is only recommended for healthcare workers, emergency crew, and cash handlers. Everybody else, it can actually increase the self-viral transmission. Moreover, consider breathing fresh air directly in open spaces such as parks, cycling, etc. The next section we're going to move to look at the natural ways of boosting the immune system and protecting from COVID-19 to minimize the risk. So why is it important to maintain an optimal immune system? Having a stronger innate immune system protects oneself from COVID. It can be built and maintained by natural means. This depends on having adequate vitamin D in the body and micronutrient adequacy, minimizing stress and mental relaxation, and reasonable daily physical activities. So let us discuss these in the order of importance. Firstly, the adequacy of vitamin D. Regular exposure to summer-like sunlight between 10:30 a.m. and 1:30 p.m., but not 8 to 10 a.m. as claimed by some, for minimum of 30 minutes, at least 1/3 of the body surface area exposed, could generate between about 800 to 2,500 international units of vitamin D. This does not need to be done on a continuous basis, but it could be 10 minutes period into 3 or 4 times. Exposure to sunlight with 1/3 of the skin area on a daily basis is one easier way to maintain the immune system. Important to note that vitamin D is not generated during winter months, and exposure to sunlight during morning and evening do not generate virtually any vitamin D within the body. So what about the strengthening the immune system with vitamin D supplementation? How much good need for that? Regular intakes of over-the-counter vitamin D supplements between 3,000 and 6,000 international units per day, on average about 4,000 units per day, or one could take one capsule of 50,000 international unit every other week to maintain the immune system at high alert. Using these means, about 98% of the people could maintain their immune system at high alert. However, in emergencies like following exposure to COVID or sick persons, one need to take higher doses to boost the immune system rapidly. In the absence of adequate sun exposure, for most people, the best option is to take about 4,000 international units per day during the COVID pandemic period, and then can get back to the routine daily maintenance dose of about 2,000 when the pandemic is over. This approach should cost no more than $6 to $8 per person per year, which is much cheaper than getting a disease and attending to that in due course. However, a small percentage of people with chronic diseases such as obesity, hypertension, metabolic disorders, cancer, autoimmune disease, and gastrointestinal disease are likely to require much higher daily doses to maintain physiological vitamin D concentration. In this regard, the minimum necessary physiologic blood concentration for health is 30 nanograms per mil. However, over 40 nanograms per mil are going to be necessary during the COVID era to optimize the immune system, especially in the elderly and those with multiple comorbidities. For less than 0.2% of the people who are oversensitive to vitamin D, such as those with the ongoing granulomatous disease like sarcoidosis, and those with the raised blood or urine calcium, such as following primary or tertiary hyperparathyroidism, vitamin D should be administered even smaller doses under medical care and guidance and testing blood and urine calcium levels. For all others, testing blood levels for vitamin D is a waste of money and is not recommended by virtually most endocrine societies across the world. Above mentioned amount of vitamin D, however, will not cause toxicity. The toxicity will not manifest until the blood level exceeds above 125 or in most cases 150 nanograms per milliliter. To achieve such levels, millions of units of vitamin D need to get ingested. Therefore, except in the mentioned specific circumstances, the measurement of blood vitamin D concentration is unnecessary. What other micronutrient supplements are needed to boost the immune system? Additional supplements such as zinc, which is present in nuts and seafoods, about 25 milligrams daily, and 50 milligrams every other day. Selenium in the range of 50 to 100 micrograms per day. Omega-3 fatty acids, about a gram a day. Fish oil capsules, or eating fish frequently. Antioxidants are essential and present in almost all colored vegetables, and magnesium, having a banana a day, will provide at least 150 to 200 milligrams of magnesium, would improve the efficiency of vitamin D and its receptor interaction on gene activation. These micronutrients will facilitate to optimize the innate and adaptive immune system to protect yourself from COVID-19. However, most of the above mentioned micronutrients can be obtained through a balanced diet, and you don't need to buy from pharmacies or some other sources. In addition to the above, 7 to 8 hours of sleep, mental relaxation via meditation, Tai Chi, listening to music, etc., and thinking positive and staying positive will also benefit having a good healthy system, especially strengthening the immunity against COVID-19 crisis. I hope the suggestion we made through this mini series of videos will be helpful to stay healthy and keep healthy during COVID-19 crisis. If you are interested in more information, please follow and listen to the YouTube video channel of myself. If you type in the Google Sunil Vimala Vansa YouTube channel, you should be able to pull out over 60 mini video series, educational video series, where you can address this issue. So be prepared, stay prepared, and stay healthy. you can do it. Thank you for participating in this mini series of education videos. I'm Professor Sunil Vimalavansa, and see you in the next video. Stay healthy.